Welcome everyone to our Mental Health for All webinar from the Global Mental Health Action Network. It's great to have a global audience and a global panel today for this really important conversation. This is our latest webinar in our series, which we've been running for a number of years now. And the network continues to grow and engage in those conversations over this time, and really thank you for your support and your engagement with our events. We now have more than 8,000 advocates, members from over 170 countries around the world. So these are really important and strategic conversations, not just informational, because we're coming together from many different parts of the world and many different parts of the mental health sector. So today we'll be discussing about going beyond the high-level meeting on non-communicable disease and mental health that happened about 5 or 6 weeks ago in New York at the United Nations General Assembly. And we will be reflecting together on how we can implement what happened at the high-level meeting, how we can implement commitments, and how we can hold governments accountable for them. So it will be a really interesting discussion. To introduce myself, I'm Antonis Kousoulis. I'm the Secretariat Lead for the Global Mental Health Action Network, working also with United for Global Mental Health as Director of Partnerships. And we have a great panel today. All people that I really value and I know are doing incredible work in their areas. So you will hear from all of them. So I will just briefly now share their names and titles, but you'll hear in a little bit from all of them directly. So we have James Sale, who is Deputy CEO at United for Global Mental Health. We have Lucero Andaluz, who is the Executive Director of Dementes in Peru. Shani Geffen, the advocacy lead at the South African Federation for Mental Health. Eva Kegele, the technical officer at the World Health Organization in New York. And Katrine Fladd, who is the mental health policy and advocacy officer for UNICEF in New York. Obviously, the high-level meeting was a big milestone. The first time ever that we had mental health featuring at the core of a meeting of heads of state in New York. It was an important moment in time. A lot of us worked for a number of months and even years in the lead up to it, including people on this panel. But it was, in many ways, it was not just the end of long advocacy work, but it's also the start of a new period focusing on where we can push for accountability, sustain progress, and continuing to see commitments, implementation, and increased funding for mental health in different countries around the world. So today we will reflect on this historic moment. We will reflect on the outcomes from the political declaration and where we are with that. And we will discuss how we as advocates, as civil society, as UN agencies, as partners in the sector can transform those commitments into meaningful and lasting reforms and implementation nationally and globally. Please do introduce yourself in the chat. Tell us where you're coming from, where you work. It'll be really interesting to see the spread of experiences and backgrounds that are in the virtual room today. We also have a poll. You will notice on the side of your screen a link to a poll. These are the priority areas that when we started that journey, our global community identified as key for mental health for the high-level meeting. So that's over a year ago. And we're now interested to see what are your priorities from that list? What are your top 3 priorities from that list in your work now after the high-level meeting? So we will be collecting those responses and informing also our work. But you can also write in the chat. You can write what is important for you at this stage and what are your advocacy priorities in your country over the next few months. And maybe what's missing perhaps from that list from your point of view. Or what are you really focusing in depth on from your point of view? So it'll be really interesting to hear all of those reflections from you as an audience of advocates and partners and members from around the world. And we will be collecting all that information, so please do engage with that. So with that, I will start handing over to our excellent panel. There will be space at the end for your questions. There is, again, on the right hand side of your screen, you will see the icon for questions. So you can type your questions there. You can also upvote using the heart button someone else's question if you would really like a response to that. And the system kind of gives a ranking of questions based on that. So please, you're very welcome to engage with that as well. Great. So let's get on then with our conversation. And James, I will come to you first. I was wondering if you could please give us a short overview of how mental health was actually represented in the political declaration of the high-level meeting.
Yeah, thanks so much, Antonis. It's a pleasure to be here. We don't have long, and there's a lot to get through, so I'm gonna crack straight on with this. The political declaration is sort of the outcome document of the high-level meeting, and the high-level meeting is when UN member states gather to speak about a particular issue, and in this case, it was NCDs and mental health. If you have any questions on the technicalities of a political declaration, do ask us at the panel. I hope we can answer that, as I'm a bit short on time here. But just to let you know what this is, that it's not a legally binding document, but it just set out the intentions of member states and other UN technical agencies about what can be done on a particular issue. So in that way, there are commitments within them, and that's what we were focusing on. The process of this political declaration started much earlier in the year. In fact, probably earlier than is even on this timeline. But just to give you a sense of the different drafts that happened. So there was a zero draft, and then went through 4 iterations, possibly 5 actually now, to get to the final one. And then throughout that process, there's lots of negotiations, civil society engagement, and other processes that happen to get to the final document. With the mental health community and the civil society community in particular, we applied really a quite traditional sort of advocacy strategy to this, which was with those that hold power, those decision makers, so those member states, governments, as we also call them, is to take those through a process of awareness raising on mental health issues, to allow them to have a good understanding of those issues, committing to good text within the political declaration. And the action point was actually having that good text in the political declaration. And for different issues we'll look at now, we got further along this process than others, and it was we spent longer at different stages than we thought we would, but this is sort of the process or the strategy we were thinking as a mental health community. So then, looking at the political declaration, one way of looking at it is just a keyword search. So how many times is mental health mentioned, and how many times are different keywords mentioned? And I sort of highlighted young people and children there in particular, because that was one of the priority areas. And actually, those priority issues that we identified as a community were really the top 4 there. So strengthening mental health systems, young people's mental health, preventing suicide, and social and commercial determinants of mental health. But I've added in financing there as well, because that was a priority issue that sort of cut across these. And this is how we then sort of analyze the political declaration against these priority issues. So firstly, looking at strengthening mental health systems, we started off talking about the deinstitutionalization of mental health systems, and then we broadened it to be strengthening mental health systems. And you can see within the text, so this is the text directly taken from the political declaration. And on this slide here, we just got what is the commitments. So it starts at the section of the political declaration starts off with UN member states therefore commit to urgently, and then there's sort of maybe 30, 40 paragraphs of different things, different issues. These are 2, and not the only 2, but 2 prominent ones on system strengthening for mental health. And you can see there that scaling up is the first language test. We know that we have low level of coverage at the moment. That needs to be increased. Psychological and psychosocial support, as well as pharmacological treatments, was included. And we also had child and youth mental health coming through in towards the end of not in the zero draft of the political declaration, and really had to push for that inclusion, and it came through more strongly. But one thing I wanted to highlight here is the very last sentence, which is about deinstitutionalization, so shifting away from mental health care and resources from specialized institutions, so tertiary facilities, mental health hospitals, psychiatric wards, asylums, towards general healthcare delivered at community-based settings, and primary and community-based settings as platforms for NCDs and mental health services was a theme that runs through the political declaration. Young people was another priority area for that we as the Action Network identified as a priority issue. As I mentioned in the previous slide, actually the zero draft didn't have the strongest language or the most frequent mentions of young people, and then there was a lot of doubling down on advocacy efforts to make sure that young people came throughout the political declaration, not just in mental health. But here's some of the text. So before I showed the commitment text, we also here have the preamble, and the preamble of the political declaration is where we're setting out what is the current landscape, and it's important to have issues identified in that as well, a recognition that this is the level where we are at the moment and we need to do better. So we had that for children and young people, and then in the children and young people were integrated across the different priority issues, but specific paragraphs on young people are ones that most relevant. We had two actually in particular on digital mental health, or the online safety and the mental health of young people engaging online, and that was quite an interesting point that came through strongly in the political declaration. The third area is preventing suicide. We're really pleased with this. I think you'll see from the 8 specific areas identified in the political declaration that 4 of those are the WHO Live Life approach to preventing suicide, and then we have 4 additional ones put in there. I think that developing national suicide prevention strategies and plans is incredibly important, and we were really pleased to see that in there, that member states committing to developing those. And you can see there's a number of additional pieces in there, such as fostering a public health approach to suicide prevention, which was very key. Fourth area was on social and commercial determinants, and I think thinking back to that strategy of phasing for advocacy, getting towards action for commercial and social determinants in mental health was a stretch goal for us. We really felt that getting towards understanding that commercial and social determinants aren't just a physical health issue, that there are commercial and social determinants of mental health, particularly that commercial determinants of mental health, we felt is something that is not well known outside of the mental health community. And so we want to do a lot of awareness raising and understanding work for member states when it comes to commercial determinants of mental health. But you can see the language there is actually quite geared towards the preamble. So the political declaration acknowledges the situation. The commitment is quite short and not as detailed as we would like for mental health. That fifth area I mentioned of financing, here there's the language around that I think is most relevant to mental health. And you can see then that community and primary level care really comes through strongly in the preamble. But again, it's the last paragraph, the third paragraph of this that I think is most progressive or most important for mental health. And that's about integrating mental health into financial protection policies and having essential services covered within those. And that's something that I think we can do a lot of work on holding governments to account on. Lastly, I just pulled out the targets that are within the political declaration. So the first one is really key, and we were very pleased to see that included. So 150 more people have access to mental health care. That was included alongside other 150 million targets for different physical health elements, but we were pleased to see mental health specifically mentioned. And you can see going through that we go from policies and legislation through to health system strengthening, financing, strategy and action plans, and also surveillance. And you can see the targets there. All of those but one are 80%, 60% is on financial protection. I feel for the 80% threshold, that is progressive from where we are at the moment and what data we have on mental health, and even the 60%, to be perfectly honest. If you put these targets against the latest mental health WHO mental health atlas, you can see that, in the 6 years that's been given for this political declaration to be achieved, that would be a significant step forward for the sector. So I'll stop there because I could go on at length for this, but I just wanted to give you an overview of the political declaration using the priority areas that we set out as mental health civil society. So back to you, Antonis.
Thank you so much, James, for setting the scene and giving us that context and content there. Lots of people are already wanting the slides, which we can share. There's also a range of blogs and information on our website, so we can pull together some links and include in the follow-up to everyone who registered to that webinar. I can see also a lot of interesting questions coming through in terms of working for advocates working and supporting within the work you do in your countries. Definitely start sharing your priorities maybe in the chat. We're also on our Circle platform. If you're a member of the network, you can access Circle. If not, it's a free membership. You can join us from our website, and we'll put the links in the chat towards the end as well. One thing I neglected to say, I think some of you have found that already, there is a transcription under the chat function. You will see a transcription option, and there you can also translate. You can get a live AI-driven translation if that would help you to follow the conversation. So thanks again, James, for that context. I will go on to Eva now, and Eva, we would love your perspective from New York. You have been very close to the process for well over a year, I think, in the lead up to the high-level meeting. We would love your perspective on what you noticed in terms of what was the influencing that worked well, what didn't work. It was a very complex journey, of course. And what, in your view, thinking about the UN landscape in New York, how should advocates approach this from an influencing perspective now? Thank you.
Thank you, Antonis, and it's a pleasure to be here, and hello, everyone. As James mentioned, the preparations for this started very early on, and I had the pleasure, or honestly, the big challenge of supporting the co-facilitators and the Office of the President of the General Assembly throughout the negotiations and then the organization of the stakeholder hearing and the high-level meeting itself. And this was my fourth high-level meeting and high-level process, and I would say that definitely by far the most challenging one. And I will explain a little bit on why that turned out to be the case. Yes, mental health was well positioned since the early preparations, and also from WHO's side. There was a development of different background reports, thematic briefs, stakeholder consultations, member state briefings. One of those was the one that WHO organized in collaboration with the UN Foundation, the monthly member state briefings, just to get the delegates here at the UN more familiarized with the topics, give them more background, more insight into the complexities and different angles of what they are about to negotiate in the outcome document. And all of these included a strong mental health component, which provided to be really valuable in positioning mental health as a key component in this outcome. For example, we made sure that we illustrate how the NCDs' major risk factors also apply to mental health, and how mental health is impacted by these risk factors, namely unhealthy diet, lack of physical activity, alcohol, tobacco use, air pollution, so that it kind of links it for the delegates already, how all of this is kind of in conjunction. Another major influencing moment was the multi-stakeholder hearing, which had a really tremendous outcome and participation, and strong statements from civil society with very aligned messaging, which was really important. And also the engagement of persons with lived experience was powerful and impactful, and really underscored the importance of the topic, but also the kind of the responsibility that the delegates had in terms of negotiating a strong outcome that can really help achieve better mental health outcomes. The vast majority of mental health issues and asks that were set out from the beginning, like suicide prevention, youth mental health, including language on decriminalization, made it into the outcome document. And this is largely, to our understanding, due to the strong advocacy efforts and direct work with member states conveying a unified message on the priority topics and their importance. And we really noticed that the more stakeholders from different sectors approach the member states, and the more member states they managed to get through, the easier it was in the negotiating room to get that language in the document in the strongest possible way. We have noticed in other high level processes that that always hasn't been the case, that the civil society comes with kind of different messages and sometimes a little bit contradicting messages, and that creates a confusion among member states, and that's not very helpful in terms of getting a good strong outcome, because then that results in kind of diluted messaging and different positioning. So in this case, we really noticed that there is that alignment, and then there is that one kind of unified message, and that was one of the success stories for mental health in this document. Um, to address a little bit the negotiation process, this one was really troubled, reflecting the geopolitical rifts and disharmony. Positions on some of the issues, especially decriminalization of suicide, substance use, were so wide apart that finding consensus was nearly impossible. While WHO, we really championed the primary healthcare approach and emphasized it throughout the negotiations of how that should be kind of the base for mental health delivery. Some member states would still insist on long-standing policies, including institutionalization, which then took a lot of effort to kind of debunk and to show the evidence and substantiation of why that is not the most successful and best way to address mental health. So the political declaration, which is still awaiting the final endorsement by the UN General Assembly, we think that it really has an unprecedented recognition and commitments and global outcome targets, and it kind of provides a new calling card for greater prioritization, integration, and strengthening of mental health work. It is also, as any declaration, a great advocacy tool that should be leveraged in your further work with the governments to help them find the best ways on how to implement these targets and deliver on the commitments according to, of course, their national circumstances. There's a lot of work to be done, and when we were defining and kind of defending the five system level targets that James mentioned, we realized that mental health is quite far behind the NCDs. And also, one of the issues was the data and surveillance, and that could really be significantly improved so that we are better prepared when the next negotiations come, that we have the data to base our metrics and our targets on. The next high level meeting is proposed in 2031, where we expect that the governments will want to come and present their achievements. And I really believe that with a coordinated and aligned approach among the UN system, the various stakeholders, we can make sure that they come with good examples and good stories to tell, and all of us can proactively take part in it and keep up with the good work. Thank you.
Thank you. Thanks so much, Eva. That was really helpful, and as you have been throughout this whole year for mental health and the global community as well. So thanks so much for these reflections. That was really insightful. I'll come on to you, Lucero, now. You have represented your organization, your own work, and also your country in many cases across multiple steps towards the high-level meeting over the past year. And I'd be interested in hearing what have been your highlights in this influencing journey. And also in Peru, what are you now focusing on from an advocacy perspective? Thank you.
Thank you very much, Anthony, for the question. And thank you all. It's very nice to be here and share this space with you. So for me, looking back at this journey towards the high-level meeting, one of the biggest highlights for me was having the opportunity to understand how this global advocacy process work, how national and regional priorities can be translated into UN global commitments. It was very inspiring to see how we, civil society, people with lived experience, young advocates, can have a meaningful voice in shaping the agenda at the UN level. Another highlight for me was having the chance to connect with colleagues from different parts of the world, especially from the Latin American region. Through these conversations, I realized how much we share as a region, not only our passion and commitment, but also our challenges and struggles when it comes to mental health. In Latin America, we continue to face persistent stigma, very limited resources, and unfortunately, political instability that often makes it difficult to ensure continuity of public policies. In many cases, mental health systems very much remain fragmented, and prevention and community care still receive very little investment. So, being able to exchange this experience and reflect on our advocacy strategies and think together about how the high level meeting could become a real milestone for mental health at the national and local levels was incredibly valuable for me. It gave me both a sense of community but also a renewed motivation to continue working for change in my home country. So in Peru, well, we at the Mendes have been working for the past 10 years for mental health promotion and prevention. And our main advocacy focus now is to strengthen and expand the community mental health reform. This reform in Peru, at least, was introduced 10 years ago. And of course, over the past decade, we've had important progress, but we still need very much stronger investments to reach real milestones and real change. This means advocating for more budget allocation to open and sustain more community mental health centers nationwide, especially in rural and remote areas in the Andean highlands and the Amazon rainforest, and ensuring that these services are also culturally pertinent and adapted to local realities, especially in these rural areas. Another very important priority for us is youth mental health. Young people in Peru, as in many other parts of the world, especially in low and middle income countries, are facing growing mental health challenges, and we are working to ensure that their voices are heard in policy discussions and that youth mental health becomes a clear priority in our national agenda. We have also been working for the past 10 years to position mental health not only as a clinical and biomedical issue, but mostly as a fundamental aspect for sustainable development. So, we want to show how health intersects with other aspects of sustainable development, such as climate change, employment, education, and the economy, and how investing in it can strengthen communities, productivity, and also social cohesion. Next year for us in Peru is election year, and this makes it an especially important moment for advocacy. We are trying to ensure that mental health is included in political platforms and also in the agenda of the candidates, and that the candidates actually understand the relevance of it as a national priority. So, to be completely honest, the high level meeting gives us a strong foundation to do this. It provides commitments and international legitimacy that we can use to hold our leaders accountable and, also to promote that candidates are starting to talk about this in their campaigns. So for me, in short, this journey has been about learning, connecting, and also translating now this global momentum into national and local change, into national and local policies. And yeah, we will continue to advocate for a Peru where mental health is truly seen as an essential part of sustainable development, as a national priority in our agenda. Thank you.
Thank you. Thanks so much, Lucero. And it's been amazing to see you throughout the past year linking the national to the global and also the personal to the systemic. And you've done some incredible advocacy. So thanks so much for these insights from your work in Peru. Really excited to hear about those. And I think similarly, Shane, you've done some really strong advocacy for South Africa to play an important role in mental health. And again, you've really advocated for mental health both in your country and in New York and internationally. So I was wondering if you could share what are your key points of progress that you have noticed from the past year, and what are you focusing now on in South Africa from your advocacy?
Yeah, in South Africa, there's definitely been an increase in awareness and recognition of mental health, including amongst many NCD colleagues, so including NCD advocates. I think for many years, mental health might have felt like an add-on to the conversation, but I think this past year it's really become a core part of the NCD conversation. And I think that the high-level meeting also gave us as mental health advocates in South Africa a really valuable opportunity to engage positively with our local decision makers. We were speaking with colleagues who were not our usual contacts, so from the NCD Directorate, from the Department of International Relations, and they seemed to just genuinely support the political declaration, what it was calling for. They were actively interested in discussing mental health. And I really got the sense that discussions about mental health don't often come across their desks. And so when there was that space, and when it did, there really was a sense of openness. I think when reviewing the high-level meeting priorities, what was very excellent and unexpected a little bit was that the Department of Health colleague invited the NCD Alliance in South Africa, with whom we at the South African Federation for Mental Health work closely with on this, to review the draft and also add any inputs from civil society from a local level. They kept us posted about when they submitted their inputs and made sure to let us know that they got it in ahead of the deadline. And they provided a very, very high level reflection about how South Africa's inputs and feedback had been received at a global stage. And I think that's definitely not something that I take for granted, because the sort of feedback, the sort of friendly engagement, the sort of collaboration is not something that I think I often see working at a national level in advocacy. And it's something which I'm very grateful for. So last year, South Africa launched a national strategic plan for NCDs and mental health. And this, alongside our mental health policy framework, gives us a really good domestic roadmap for implementing many of the goals that are also highlighted in the political declaration, just tailored to our context. But that said, challenges remain. I think one big one. On balance, while South Africa is pretty excellent at advancing visions and upholding ideals and setting ambitious goals, really translating these ideals into tangible on-the-ground change has not always been our strong suit. And so addressing this gap, I think, is really at the heart of our advocacy work. And so what we've been focusing on in light of this challenge is mainly on governance, implementation, monitoring, accountability. And this really ranges as to how we can work to inform and remind duty bearers about their roles and responsibilities outlined in policies, and to advocating to get more publicly accessible data to track the progress on our national targets. Thank you.
Thank you, Shani. That's amazing. And I think noticing the leadership from South Africa over the past year, and also the leadership from your organization on mental health, has been really inspiring. So thanks so much also for these reflections. Really interesting. Katrina, we've heard the context already from James. The highest number of child and youth mentions in the declaration than before. I'm also noticing in the poll, it's polling ahead of everything else at the moment, child and youth as a priority area for our audience today. So no doubt the work you've done within the team at UNICEF to increase youth participation in shaping priorities and really to ensure some key commitments for child and youth mental health has paid dividends. So thank you for that. So with that in mind, and with youth mental health now strongly representative, seeing that interest, I think, around the advocacy world at least, what are your priorities for accountability in your work after the General Assembly?
Thank you. Thank you very much for that question. And also thank you so much for organizing this important webinar. It's super great to be part of this. And I think that today is also a very powerful reminder of both the urgency and also the opportunity to act. And then as UNICEF, especially for children and young people. So as has already kind of been mentioned, over the past 2 years, we witnessed a political awakening around mental health, and it is now a global priority. And for UNICEF, this high-level meeting on NCDs and mental health was a pivotal moment. And our message was very clear, and that was to place children and adolescents at the heart of the mental health agenda. And we've already touched upon that the mentions of children has significantly increased from the 2018 political declaration to this most recent political declaration. And it's not just about progress, it's also a signal that the world is finally recognizing children and young people's unique mental health needs. And in these efforts, we have also included young people in the advocacy efforts as well, and gotten their inputs as well in our advocacy efforts and to kind of then also build on this momentum, because there's a lot of possibilities, which has also been mentioned by the others speaking here, to build on this momentum and to ensure that the high level meeting translates into tangible action for children and young people. UNICEF's post-UNGA priorities are to equip UNICEF offices with advocacy tools and resources to then translate commitments into actions, to make sure there are multi-sectoral plans that include child and adolescent specific targets and indicators. Also, to continue to integrate mental health and NCD language across global platforms and UNICEF channels, potentially through a digital campaign, and also really to continue to strengthen and also amplify youth voices and young people living with NCD and mental health conditions. And a concrete example of this is that this week during the World Social Summit, UNICEF is co-organizing together with the UN Youth Office, UNESCO, and WHO a solution session titled Youth Leading the Way, Reimagining the Future of Child and Youth Mental Health and Wellbeing, where young people are really at the center of that solution session. And then over to our accountability priorities specifically. So while there's a global momentum that is growing, there's a significant gap remaining between commitments and implementation. And right after the high-level meeting, ministers also met at the Qatar Global Ministerial Mental Health Summit, where accountability to drive meaningful action for child and adolescent mental health really emerged as a key priority. And there, UNICEF and WHO committed to establishing a mechanism to support this. So the accountability mechanism that we are aiming to do is aiming to encourage governments to take concrete action through financial, policy, or other interventions to better support the mental health of children and adolescents and caregivers, and also to allow governments to effectively monitor and implement commitments relating to the specific area and strengthen transparency and accountability. So following the Qatar summit, UNICEF and WHO will collaborate with partners to identify and refine and validate a set of policy commitments that can be documented through this accountability mechanism. And our ambition is to launch an interactive web platform in 2026 to showcase government commitments and also to update on progress. And to make sure that accountability is there, we need both political will and also finance. And we really also think it's important to engage with the private sector and emphasize kind of on the power of public-private partnerships to drive implementation and also scale. So really, this accountability mechanism will be part of our key priorities moving forward. So thank you so much.
Thank you. Thanks so much, Katrina. And really excited for this work and to engage and use the accountability mechanism in 2026. We will also share that with our community when ready. So thank you, everyone. That's been a really insightful series of comments and reflections. And to really help kind of contextualize where we are and where we're going next, kind of on the back of the high-level meeting. For the audience, please share your questions either in the chat or the questions section. We have some time to take questions for our panelists. One thing that has come up, and it is coming up also in discussions, is the fate of the actual document of the political declaration. I know Eva has already addressed the question that probably expecting a vote in the next few weeks, but I was wondering, Eva or James, maybe your perspective on to what extent are we bound to kind of wait for that vote, or should we, from an advocacy point of view, be working on it already? We've had, I don't know, maybe 100 member states or more committing to mental health already, right? So keen to hear your reflections on the nuances of the declaration and the advocacy work that follows.
Yes, absolutely. I'm happy to start, and if James would like to add anything. I don't think there's any reason to wait. Like you mentioned, we heard very loudly and clearly in the high level meeting of the overall support to the document, and the co-facilitators, when they transmitted the document to the President of the General Assembly, mentioned that this is the best consensus outcome that they could achieve given the circumstances. And I can attest, being in the room, that it had absolutely the majority of support. And the right now where we are stuck on is simply kind of procedural issues, and those should be resolved in the coming weeks. But there's absolutely no doubt that the document will be adopted. There might be some voting, some disassociation, which we expect, again, given the geopolitical situation. But it is a strong outcome, and it is an outcome that absolute majority of the member states already agreed to.
Yeah, I just add to that. There's three things to mention. One is that I don't think, from my interpretation, that the difficulties or the political difficulties with consensus for the political declaration has anything to do with the mental health language. I didn't get that sense throughout all of the process. And speaking to colleagues and friends and in other areas of the NCD world, I think the issues lie in that area. So things like health taxes, for example. Now, these aren't part of or necessarily part of the priority areas that we set out. I don't think it's the mental health language which is causing the non-consensus on this. And the mental health language didn't massively change throughout those revisions that I showed on the slide earlier. That the negotiations of member states wasn't happening around those paragraphs, and so I don't think it's that language. The other point is that I don't know how useful this is, but for those that do national advocacy work, the way I see a high-level meeting and then the UN General Assembly is that the high-level meeting is like a parliamentary committee where legislation and bills are discussed, developed, crafted, and that the UN General Assembly is like the Parliament's main chamber where representatives will vote on what comes out of that legislative process or coming out of the committee. So we had the high-level meeting, which was like a parliamentary committee. We were discussing for months and months, and not a year, about what that should be. And then that was then taken out of the committee and put into the main chamber, the UN General Assembly, where the official vote will happen. And on that, my Eva will know better than this, but my guesstimate is that if there are member states that will vote against the political declaration, it would probably be a handful, if not less. And if there might be 2 handfuls of abstentions, and the rest of those 190 odd member states will be voting in favour. So, it's an overwhelming majority that will be voting in favour of this political declaration, is my take as a civil society advocate on the outside of the process.
Thank you so much, both. That's really useful and I think helpful for everyone to understand that context and on where we are on that. Any questions for our panelists, feel free to add in the question section or in the chat today. I wanted to ask Shane and Lucero a question, if I may. A lot of the work that we are referring to, and I think that analogy from James on the local parliaments and the global processes is useful. You're doing maybe 99% of your work is national, is at the level of your government and your partners on the ground. But it'd be really interesting to hear your perspective on why is this engagement with global processes useful for you? What have you gained from it? And how has it been helping kind of your national advocacy as well? Maybe Shane, I'll start with you.
Yeah, thanks, Antonis. I think it was, as I said earlier, the biggest one has just to be able to work positively with our duty bearers and decision makers. You know, us saying we want better mental health outcomes, we want it to feature more on the global stage, them saying we can try to make that happen, we're on the same page as you, let's do this. You know, sometimes our engagements with government departments can be more, please, can we get this done? The answer is not always a clear yes. And so it is nice to be able to say, let's work at this together on the same page. Great, let's take this to the global stage. We're all for human rights. We want this to feature. And so just to be able to have that ability to work positively together, I think definitely transcends into our other advocacy work where we are discussing things like, okay, but now on the ground, in terms of actually trying to make this happen, how are we going to reform some of our systems on the ground over here? Because we've had this positive experience of working together on this separate global political declaration, I think it does make our local working relationships better.
Thanks so much, Amy. Lucero.
Yeah, thank you, Antonis. I would definitely echo what Shani has been saying. It's the same for me here in Peru, but I would also add two things. The first is, as I mentioned, this, momentum gives us the foundation, the international legitimacy that we need in order to continue making and, fighting for mental health to be a priority in the national agenda. So in a context, as I was saying, in the context that we have in Peru, but in most of Latin America, with so much political instability and continuous changes in the governments, this gives us a platform to say, okay, so we have these international commitments that have been made by our country and that we need to fulfill. So this gives us, a platform to continue, pursuing our national advocacy efforts. And another thing that I would add is, this this component of just sharing and learning from the advocacy work of other colleagues in other countries, sharing best practices and be able to come up with, collaboration ideas and initiatives that, could have been probably thought of in other regions of the world and for other types of communities, but that could also be translated and adapted into my local and national context. So I feel like that has been very valuable for me as well.
Thank you, Lucero. You've already started answering a question that has come in from Veronica for you and Shani. I'll just read it out from the chat. I'm curious how the outcomes of the high-level meeting translate into your day-to-day advocacy work, how it informs your on-the-ground work, and whether it provides more momentum for the operational tasks that push this movement forward. Did you want to add anything, Lucero? I know you've partly covered that already.
Yeah, definitely. So for us, we have been working closely with our national youth secretariat, which is SENAJU, Secretaría Nacional de Juventud in Peru. And yeah, definitely a strong focus on youth mental health in the high level meeting has gave us a strong foundation to maybe deepen our work in youth mental health, especially in different parts of the country. We're working right now in a project with the National Youth Secretariat in 3 regions of our country that are especially relevant when it comes to mental health and challenges in youth mental health. So I feel like, this global momentum and international commitments just paves the way to have more investment in policies and interventions. So yeah, let's say that.
Thank you, Lucero. Shani, I think you wanted to add.
Yeah, absolutely agree with what Lucero said. I think another really positive outcome is that we've strengthened our relationship with the NCD Alliance in South Africa. And when you're able to come as a united front across different sectors with clear messages, the Department of Health listens more. And so I think that really does strengthen the momentum to keep the work going. And just personally, as a mental health advocate, being able to speak with other people who are also advocating for mental health at this moment across the world, it's been really, really sustaining. So I'm very grateful for the space that has been set up and for the ongoing work.
Thank you so much. Thank you both. And thanks for inspiring members around the world as well to engage in this way. I have a really interesting question from Valentina in the questions. I think I will address it to Eva and Katrina to start with. How is the increased polarization of views across and within member states and the decrease in trust in multilateralism and democracy has affected mental health advocacy during this process? So maybe start from our UN agency colleagues as a first reflection.
Okay, I'll go ahead first. Yes, like I mentioned uh, in my presentation at the beginning, that since I started working here at the WHO UN office, and I've supported about four high level processes, the 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 situation has really changed, and it has become more and more difficult to get consensus on anything. In fact, since 2019, no health process, no health political declaration has been agreed by consensus. There has always been some voting or association abstentions. So it has become more difficult, and that's why it has been so crucial, and that's why, as I mentioned, this process was successful for the mental health outcomes, that there is that coordinated and unified message, and that it comes across from various sectors. And the more that's kind of pushed through, the more it resonates with the member states, and the more they feel like, okay, this is really important, and this is important across many sectors, not just for one organization or one advocacy group. So it was really complicated on many levels due to the really geopolitical um, situation, but I felt like for mental health, we kind of managed to get around that with that strong advocacy and coordination.
Thank you, Eva, so much. Katrina, any thoughts from you?
Thank you. Just to kind of also add to what Eva is saying, I think in addition that advocacy messaging is also evidence based, is also um, very helpful and useful. So, and then that it is coordinated and saying similar things helps to get things through and across. Back
Thanks
to you,
so much.
James.
I don't know, James, if you want to add anything to that. And also, there's an ambitious question related in the chat, which is, should the declarations be binding on governments for implementation? So, your thoughts on that?
Just very quickly, because I know we don't have a huge amount of time. Yes, I do think that the fragmented views across member states did impact the political declaration. One that I saw from the outset was a small number of member states not wanting to have disaggregated population groups identified within the political declaration, i.e., the LGBTQI community or other types of marginalized groups. The impact of that, I felt, was in the zero draft. We had less discussions about age appropriate services for people, because then you were disaggregating a population group on age. That then got slightly reversed, and we were able to improve the language for young people, but still there was a lot of marginalized groups that were left out of it because of that reticence from a small number of member states. And then just on the point about legally binding, I suppose it wraps up into a greater point, is that, the multilateral system is fragile at the moment. It is under attack. Now, I'm a believer in international cooperation and the multilateral system to come to universal solutions to global problems, and mental health is one of those. And I think we need to support that and buy into these processes, make them as powerful as possible, engage in them. If we only see the faults in these types of processes, we're only adding to the threats that are placed upon multilateral systems like the UN at the moment. And actually, we need to see what is the net positive out of this, and really celebrate that. The counterfactual of what do we do with a weakened UN system, or what would happen to the world if there was no USAID? We are living out now. And we need to have more unified international, and that means with civil society as well, collaboration at all levels, local, national, regional, global, to make sure that we are strong and that we strengthen those systems that I hope or I think lead to better outcomes.
Thank you so much. I think that's an excellent note to start closing our webinar on. And in many ways, it's our community. It's the community of advocates, of activists with lived experience, of organizations working on the ground at national level that will be holding governments to account and will be supporting the work of WHO, UNICEF, and others as well on that front. So do join us. If you haven't, if you're not a member already, do join us. Visit our website, gmhan.org, Global Mental Health Action Network. There is a join button. It's a free membership. You can also engage on our online forum circle. And you can share your priorities at the national level. You can connect with people in your region, and you can share also what has been missing from this conversation. And I can see a few comments already identifying some of those. So we will close now, hopefully with a small note on inspiration from our panel, a final brief contribution. I will ask each of our panelists to complete a tweet-length statement, so just a sentence, and then we will close our webinar. So to support accountability for the high-level meeting commitments, mental health advocates should ... So please complete that sentence. Eva, can I come to you first?
Sure, I will probably repeat my message again that it's really helpful to coordinate and align messaging and approach to member states in helping them achieve the targets set out in the political declaration.
Thanks so much. James?
Should focus on dedicated areas for improvement and not try to improve everything all at once.
Lucero?
Yes, I'd say we should work together to turn the political declaration into concrete action at the national and local levels.
Shamie?
Yep, mental health advocates should examine existing domestic policies, plans, commitments in the context of the high-level meeting priorities, but identify opportunities within your country to influence and bring about change.
Thanks so much. Katrina?
Your voices are and have been and continue to be instrumental in ensuring that there is a political awakening about mental health, and now we must build on this momentum together. And to support accountability for the high-level meeting commitments, I encourage everyone to continue using your voices and platforms to amplify the relevant commitments to your community leaders and governments. And also, just remember that everything you do, it makes a difference, because every drop is what makes the ocean.
Thank you so much. And an excellent note on which I can add mine, which is mental health advocates should join the Global Mental Health Action Network. You will find a kind community, a passionate community, and one that's really driving change around the world. Thank you so much all for joining us today. We're looking forward to seeing you on our other sessions online and on our other platforms, and enjoy the rest of your weeks wherever you are. Thank you.
Thank you.